everybody, and welcome back to Leading Entrepreneurs of the World. I'm Stelios Hatzakis, CEO of One Business World. Leading Entrepreneurs of the World features entrepreneurs, founders, and business leaders presenting on cutting-edge topics and the latest industry developments. Our goal is to provide the global business and entrepreneurial communities with a window into the minds of those who are shaping the future of the world. Today, we're very pleased and honored to welcome leading doctor and global entrepreneur, Dr. Harshit Jain. Dr. Jain is the founder and global CEO of DocAir, the first global network of physician-only platforms for programmatic marketing. With DocAir, he's aiming to address the acute problem of rising costs of healthcare by bringing in efficiency and effectiveness in marketing to physicians by pharma brands on digital platforms with methodically use of data and creativity. A healthcare innovator, Dr. Jain is driving health transformation across the globe, delivering life-changing, creative, and sustainable ideas. Recognized as Elite 2020 Disruptor Award winner by Premier Global PM360 magazine for his venture, Harshit has addressed some of the biggest health challenges: immunization, vitamin D deficiency, diabetes, by creatively and innovatively using data. In his over 13 years of professional journey, he weaved together his domain expertise of medicine and his marketing acumen to come up and with out-of-the-box ideas and campaigns in the healthcare space. Dr. Jain, it is a great pleasure and an honor to have you here with us today to hear more on the very interesting topic of how measurement solutions increase the ROI for physician marketing campaigns. Thank you and welcome to Leading Entrepreneurs of the World.
Thank you. Thank you, Stelios, for inviting me and such a wonderful introduction. Now I'm under too much pressure to deliver now.
Thank you. Thank you. Welcome.
So the topic that I'm going to talk today is about how measurement solutions increase the ROI or return on investment for the physician marketing campaigns, right? So it's a topic often discussed, but not much is really done about it, because even after multiple discussions, we kind of tend to go around a similar space, citing lack of data or lack of connections, right? So let me first kind of start what really is measurement, right? So if you look at a Wikipedia definition of measurement, measurement is the quantification of attributes of an object or an event which can be used to compare with other objects, because it's always relative to someone, right? And when you look at attributes, right, there are often two types of attributes: the vanity attributes and the actionable attributes. The vanity attributes are the attributes which you often see here, right? And as the name suggests, these are the attributes that make you look good to others, but they do not help you understand your own performance in a way that would potentially inform future strategies. While actionable attributes are those data points which help you make decisions and help you reach its business goals. Let me give you examples of vanity metrics, right? Likes on a social media platform, right? Number of members in a community, number of impressions for a particular digital campaign, bounce rate of a website, right? These are all examples of vanity attributes. Then the actionable attribute, excuse me. Actionable attributes, few of the examples, and I'll come more from the pharmaceutical world, are things like the click-through rate, the number of prescribers, the number of prescriptions, etc. So all the numbers you saw, which can help you take decisions, which can help you achieve your goals, are the actionable metrics, right? So it's no rocket science to kind of decide which are the kind of metrics we should follow when we are looking at performance of any kind of campaign in any media, right? Whether it is offline, online, anything. Pharmaceutical as a category is a little different, behaves a little different from how the consumer marketing or advertising as a category behaves, right? Because of one key difference, that the stakeholder here is not consuming for himself. He is not a consumer. He is an influencer. So it's an influencer marketing in a way, right? Because he is taking decision for his patients, right? And I, being a physician myself, often try to think, why do we prescribe what we prescribe, right? What motivates us? But that's a different kind of challenge in itself, right? Uh, owing to this uniqueness of this category, it makes it even more challenging to measure the effectiveness of a campaign, because you may measure impressions or reach or clicks to a campaign, but then to link to whether a patient consumed the drug or not is extremely challenging, right? And unless you're able to establish that linkage, you cannot even assess the return on investment of a campaign. Right? We at Docare are trying to address this challenge and help you connect this journey so that you can assess the return on investment of every campaign, not at the end of the campaign, while during the campaign, so that the data can help you in making optimization of the campaign on the go, so that you get the best value for the every dollar that you spend, right? Now coming to attributes. So I spoke about the actionable attributes, right? But you can't measure all the actionable attributes in all the campaigns, right? It cannot always be the same for all the campaigns. The attributes depend on always depend on the challenge or the problem that you want to solve with that campaign, for which that campaign is intended, right? There would be a campaign that is driven to just grow the awareness of a new launch product, right? So there, even reach may become an actionable attribute, right? In some cases, you want to grow the business, you want to achieve your target numbers, right? In those, it's the script lift or the sales is what you would look at, right? So this was a bit on the actionable attributes and what kind of attributes you should measure. All the types of data, whether it is script lift linked to a physician linked to an impression linked to a reach, all of that data is available and there are connections available to make it happen. So any data which is available, it is possible to connect. Okay, let me switch gears and talk about how can we further improve the ROI of physician marketing campaign, right? Regular monitoring and measurement is one piece, right? If you have that data, look at the actionable insights, look at the data, take decisions, optimize, improve ROI, right? The other bit is choosing the right channel, right? Let me give an example, right? When you are on Facebook, right, you are in kind of a mindset to see what your friends are doing, like connect socially, right? And if someone tries to advertise for work there, you would not be very receptive to it, right? In fact, you would be turned off, right? They might be getting an impression because it showed up on the screen, but the likelihood of converting that particular customer is very low, right? So on the vanity metrics, it will show extremely well, right? But on actionable metrics, it's of no use. And on a business performance also, it's of no use, right? While if you if you talk about work in a channel where you're thinking about work, the likelihood of conversion would be very high, right? So selecting the right channel or the right place or the right platform is extremely important and critical in improving the return on investment of any campaign that you do, right? You may call it contextual media, right? So advertising about a vacation on a travel site is contextual, right? That's how brands gain from it. So what is contextual for a physician, right? What is that time when a physician is thinking about patient, thinking about drug, thinking about a difficult case that he wants to address, right? When he is seeing the patients, electronic health records, he is using it there. Telehealth platforms when he is interacting with the patient, right? Or e-prescribing platforms when he is writing a prescription for you, right? Or medical journals when he's searching around and looking what are the new options available. These are the examples of all contextual media, right? Which technically is called the endemic and the point of care media. The likelihood of conversion when you message or advertise on these mediums is extremely high, right? So the message, selecting the right channel is extremely important. Just by selecting the right channel, you increase the ROI of the campaigns, right? The next point there is, once you have selected the right channel, right, reaching the right audience on that right channel is also important. Like, let's say it's a drug for ophthalmologists, eye doctors, and you are advertising about a diabetes drug to that doctor, right? Again, there'll be no conversions. You advertised at the right channel, but again, the ROI of the campaign would be very less, right? So how do you ensure you select the right audience, right? So in United States, right, you can define audiences based on different attributes, and you get a list of NPIs, which are unique identification number of physicians, right? But you can go one step over and above that, right? When that audience is in that right frame of mind, then you should push your message, right? Again, the likelihood of conversion high, better ROI. Let me give you an example for this. A physician has just diagnosed a new patient with diabetes, and he wants to make a decision which oral hypoglycemic he should be writing for this particular patient, right? That's the time, if you have an oral hypoglycemic drug, if you can do the messaging to the doctor on that screen at that time, likelihood of conversion extremely high, right? Targeted advertising on the right platform to the right person at the right moment, right? Bingo, job done, right? You achieved your business objectives, you got the best conversion that you wanted, right? Now, the next thing that matters in improving the ROI and effectiveness of the campaign is the message, right? Pharma is a regulated category, and messages are often approved through a long channel, right? But through technology platforms like ours, there are many others, and a lot of research is going on. It's an ongoing process. Is using artificial intelligence, the right message can be displayed to the right user, right? So physician, like any other human, are of different types. The way they take decisions, the way they consume information, right? I kind of divide them into three different archetypes, right? So I say rational, emotional, and commercial, right? These are different motivations of physician, how they take decisions. So if your message is kind of inclined, is inspired by their motivation, and you deliver at the right place, at the right time, the likelihood of you achieving your business outcome grows, and the ROI of the campaign grows significantly, because you are eliminating all the wastage that exists, right? Through these kind of targeting, we are just removing the inefficiencies that exist in this ecosystem, right? These inefficiencies are very limited when you look at the consumer ecosystem, because it has been going on for a while, and they have developed technologies and infrastructure to reduce those inefficiencies and improve the ROI. While in the world of physician marketing, and it may sound really surprising, right? It is such an important category which affects all of us. Not much work has really been done, right? And this is what we at Docare are trying to help, bringing efficiencies and effectiveness in the pharmaceutical marketing focused on healthcare professionals. We believe if we can bring efficiencies and effectiveness in this category of physician marketing, we will be able to bring down the cost of drugs, and hence cost of healthcare, because 25% of the overall revenue is invested on marketing expense, right? Such a huge expense, this much money is not even spent on R&D, right? So coming back to the topic, I touched on four key pointers, right? First is understanding the difference between vanity metrics and actionable metrics, right? Don't focus on something which just makes you look good. I know sometimes it becomes important and relevant when you have to shine in a meeting, but the real metrics which matter is the actionable metrics. And talking to the right person on the right platform at the right moment with the right message will help in improving the ROI of campaign that you're running. And use platforms which help you in giving data in real time so that you can make modifications in any of these things. Platform which provides you actionable insights on these metrics so that you take decisions. We have seen campaigns giving ROI as high as 1:8, sometimes also on these marketing initiatives, which is kind of unheard of. The best ROI campaigns that I saw before I started this business was 1:4 and 1:5. While bringing this focus is able to grow the ROI to almost 1:8. Well, that's all I had to say. Thanks, Stelios. Are there any questions that you want to take?
Dr. Jain, thank you very much for the very insightful thoughts and the points you shared with us. Very informative, very educational overview of how physician marketing campaigns can be effective and achieve the highest possible ROI through the understanding of available data and through a solid strategy in place. One question might be, with what we are experiencing right now with the pandemic, how have you seen the broader physician marketing space having been impacted? If you could share some thoughts.
Yeah, that's a great question. See, we call ourselves as a startup born out of the pandemic. Right? So we launched ourselves in March last year when the pandemic was just kind of kicking off, was just starting. But we kind of benefited a lot from this, although I don't feel good in saying that because it is affecting the globe so badly. But we saw the adoption of digital initiatives have grown manifold by pharma across the globe. Like we are live in US, we are live in Asia, and the proposals which used to take like 4 to 6 months earlier, digital proposals, are now kind of signed up in like less than 4 weeks' time. Right? The adoption has grown significantly from the pharmaceutical side, right? Number one. On the physician also, since the availability of physical events is low, right? The dependence on online mediums have grown significantly, right? Whether it is usage of telehealth platforms or accessing medical journals to know more about COVID management, because it is changing almost every day because new and new research is being released. So net, I think overall category has benefited immensely because of this unfortunate pandemic.
Absolutely, and it makes absolute sense. Would you say that given that we live in an increasingly global and interconnected environment, right? Would you say that these campaigns remain more local to be able to connect local physicians to their local campaigns? And what might be the case, let's say, in the space of medical tourism? If you could share some thoughts.
Yeah. Okay. So the most of the physician campaigns that we see are kind of local/regional in nature, because RX drugs, prescription drugs, is a regulated category, right? So there are limitations in what you can do and what you cannot do, right? So crossing boundaries is kind of not a common kind of an approach that a lot of drugs could do, but there could be a lot of unbranded campaigns or awareness campaigns that would cross the boundaries of for the pharmaceutical category, right? Coming to medical tourism, medical tourism has been impacted, excuse me, big time, right? Because of this, because travel has been restricted to most countries. So the advertising by medical tourism and hospitals has almost stopped. Excuse me. Yeah, so I think it will start picking up once things begin to settle down, which they have, apart from few countries which witnessed the following waves. But in other countries, things are beginning to settle down, and medical tourism will again pick up, where these doctors, these physician campaigns will play a huge role in connecting people across the globe.
Absolutely. And it makes absolute sense. Well, Dr. Jain, thank you very much once again for your time, your presentation as part of the Leading Entrepreneurs of the World series. Very insightful points. Thank you very much. And we look forward to be talking to you again soon.
Thank you. Thank you, Stelios. Thank you for inviting me. And it was great to present to this audience.
Thank you very much. Talk to you again soon. Bye-bye.
Bye-bye.